I'm Don Mooers, and welcome to Montgomery Week in Review. This week, one of the biggest headlines is the news that Superintendent of Schools Dr. Joshua Starr will not return for a second four-year term and that he is resigning in the coming days. Jane DeWinter, who comments regularly for us on education and other issues, is here to tell us the story behind the story. The state's attorney's office has an Office for Crime Prevention Initiatives. Phil Andrews, a former county council president and currently an attorney with the state's attorney's office, or advised consultant with the state's attorney's office, I apologize, is heading up this work. He's here to tell us all about what the state's attorney's office is doing for crime prevention. February issue of the Beacon has some very interesting articles. When doesn't it have interesting articles? This week or this month, the newest ideas in healthcare, as well as one of the most informative resource guides available, not just in this area, I'd say in the country. Stuart Rosenthal, editor and publisher of the Beacon, has these stories and so much more. Montgomery Moving Forward seeks to find ways to improve our county. Shirley Brandman, former president of the Montgomery County Board of Education, is the newest member of the group and is also acting as co-chair. She's here to join us. She's joining us today to explain the vision of this new, exciting initiative. Jane. Joshua. What happened to that Joshua Starr?
Well, I mean, the events are in sequence are that on Tuesday the board and he had a meeting, and where, at the end of that meeting, it was decided by mutual agreement that he would leave the school system on February 16th. And I think that most people realize that that was precipitated by items in the news over the last 10 days, indicating that there was enough board members who were planning to not renew his contract.
Isn't this strange? I mean, he's leaving so quickly. Why not finish out his term, whether he's invited back or not? Finish out his term, and then gives them time to find a new superintendent, and then there's an overlap. Is there some issue behind the issue here?
I don't know that there's any reason why, like something that people don't know that meant, that he had to go quickly because there was something we don't know about. I think it may have all just been that, when you're so publicly a lame duck, it's different than, when we knew Jerry Wiest was leaving, and it was because he was retiring, and that was a lead-in. I mean, once you've read in the paper a lot of negative stuff about you, that you're not going to get your contract renewed, you may feel like you're ineffective. You may feel like it would be difficult to move forward.
The papers also reported that he was supposed to request an extension, right? And he had, and he didn't. Isn't it? So is it on his head in some way?
Well, it is, except the deadline for him requesting the extension was after all those things had appeared in the newspaper. So it's quite possible that he was planning to request an extension, but
it seemed clear that there were conversations that were ongoing, and there was a February 1st deadline, but by then there was obviously conversations ongoing. And so, I think what we saw on Tuesday was an effort to put the system first and find a way by mutual agreement to come to a decision that was ultimately going to be in the best interest of the system. And the only thing I'd say, Don, is that the board will begin a national search. They did announce that they're going to do that.
The system is great, but what about the kids? I mean, it's without a superintendent of schools and plans and everything else to carry out. He had some exciting ideas he came in with.
But Larry Bowers, who's the chief operating officer and who's been there for a long time, who was planning to retire at the end of this school year and whose replacement had already been named, he's going to step in as interim principal. And I think that in terms of just operationally, things will keep going, and he certainly knows enough and has experience in the sense of what's going forward. And I guess the fact is that if a superintendent is leaving, and because the board doesn't, or not enough people on the board have faith in him, you wouldn't be expecting policy changes or, you know, sweeping things
Well, and the
to be
superintendent's
different.
put out a lot of important proposals. Superintendent's budget proposal has already been made public to the board in December. The board's actually going to take it up at their meeting in the second week of February. So, you know, he's participated in helping shape, I mean, to the extent that how you allocate resources and align them with the strategic plan. He's put that out. Now it's for the board to debate and to adopt the budget, you know, as their own, and he will presumably be with them at that meeting. And really the strategic planning framework, which was a lot of the work, and, you know, I for one will say I think the strategic planning framework does set, you know, a really important vision, and he really did come in with an idea about having not just a focus on academic competencies, but social emotional learning and critical thinking. There's some serious targets that were adopted by the superintendent working with the board. There's a very aggressive gap reduction effort, and so there is work that's going to continue.
So why was there so little faith in him?
It's hard for me to speak to that because I was not part of those
So Jane,
deliberations,
why was
and
there
I
so
would
little-
say,
You know, based on, you know, conversations that I had with people, whether it was, you know, in the system or was just kind of as parents, community and whatever, I think some of the things that were in the paper in terms of feeling that, you know, there was a disengagement in some ways. I mean, he went to an awful lot of events where he would be on his phone and, you know, like appearing like he wasn't even listening. I mean, I remember particularly graduation ceremony of the superintendent's leadership program where he was just kind of like this the whole time.
We've got about a minute
well, I'm
left.
going to say though that I think that the challenge, there is a challenge because I think there's always a real sense of urgency. And I think there's been a lot of public conversation about, are we far enough in 3.5 years? And very candidly, when you come in as a new superintendent, after superintendent's been in for 12 years, he did spend the first year kind of learning and listening, which is frankly what I think any new superintendent should do. And so in some ways, I feel it's not actually surprising that we're maybe not as far along as we could be. If you think he's got the right team in place and you think he's got the right vision, we probably are poised to see some results. But maybe there was an impatience. Maybe there was a desire to, you know, move along a little bit farther.
Well, I actually thought it was interesting, some of the things that were
15 seconds
reported in
left.
the paper were, you know, about particular board members sort of felt that they had been dismissed. And that to me is sort of like, okay, there was some personal, sort of personal relationship things going on.
Although
and
he
whether
really
that's
did have a
accurate.
commitment to shared governance, which I think was unique.
Okay, students, Montgomery County and
I think
benefit.
I think they'll be fine pending who we're going to bring in.
Okay. all right.
Hopefully
Remember
somebody.
a former superintendent who told me he was so lucky that he had a county full of education experts to help him in his
Oh,
job
yeah.
because all
Yeah,
these
yeah,
parents
yeah.
went to school. They all know exactly what's needed.
Oh, yeah.
What an
Yeah,
awful
it
job.
is. It
Thank
is.
you, Jane. Speaking of jobs, so preventing crime. Phil Andrews of the State's Attorney's Office, welcome.
Thank you.
Back.
Thank you.
It's great to have you back.
It's good to see you.
Tell us about these. You've got 3 prongs, as I understand, in what you're leading in this
Sure.
effort.
Well, State's Attorney John McCarthy is intensely interested in bending the curve on crime and in getting ahead of the issue. And so several of the focuses are these. One is to address the mental health crisis in the criminal justice system.
Okay.
For example, 2 years ago, we had about 13,800 bookings at our central processing unit. This year, we're down 2,000 in the number of bookings from then, which is great. But the number of people who are being seen with severe medical issues or issues that require immediate medical attention is up 15%
Okay.
in absolute numbers from 2 years ago, and about 55% of that are mental
Okay.
health issues.
All right.
So we have to do something.
So mental
because
health
we're
is
losing
number one.
ground there.
Number
Mental
two?
health is huge, and we need to address that comprehensively. Number 2, we've got to expand our truancy prevention efforts.
Sure.
We're in 10 middle schools now. It's having a good impact in those schools, but there are other schools, other middle schools, where there's significant truancy issues as well.
Before you turn to 3, we've got a phone number. People, as you're talking, people can
Right.
maybe call you right after this. What's
Great.
that number?
240-777-7400.
And what are they going to find?
They'll reach me, and I'll direct them, answer their question or direct them where they need to go.
Okay, so we got mental health, we've got truancy. What about,
Right.
what's the third?
Third one is crime prevention education, working with vulnerable groups, whether they're students or seniors, to educate them about how they can avoid becoming a victim of crime. For students, the State's Attorney's Office did about 100 presentations last year, many in the schools, on how to avoid becoming a victim of an internet predator. Things like that, and also many presentations to the community, to seniors and other organizations about how to avoid scams. So
Okay.
that's a third major area.
Perfect. What I just think, I mean, we've got Stuart is going to be coming up from the Beacon next. What exciting!
There's a
for the
special
seniors.
division just for senior elder abuse, right?
There
that
is,
right?
and Debbie Feinstein is the director of that division that encompasses elder abuse, child abuse, and domestic violence. So a lot of work is done, great work done by that unit.
And they're working particularly on like interfamily abuse, right?
Yes,
And caregiver abuse.
unfortunately, in many cases, the abuser is related to the elderly person, and that often reduces the chance that the person will report, because it's hard to turn in a family member. It's hard to feel like you have been victimized by your own family.
Well,
Phil, it's so hard when you talked about the mental health issues, and it's obviously not a problem that the state's attorney can solve alone. Who in the community are you guys working with?
Well, on the mental health issues, it does cross a lot of boundaries. And we work closely with the Corrections Department, the Police Department, HHS, and of course the court itself, and community providers. So I've been going around the state in the last few weeks looking at the mental health courts that exist now. There are mental health courts in Baltimore City, Harford County, and Prince George's County. There are several hundred around the country now, so it's not a brand new idea.
Can you tell us
Some
more
good
about what
research
that
out
means?
there.
What is that?
What it is, it's a way to divert people who are mentally ill into treatment rather than incarcerating them. Because what's happened over the past 20 years is mentally ill people, people with severe mental illness, have been deinstitutionalized out of hospitals and reinstitutionalized in the jails.
But do we have the treatments available?
Well, that's where there are some gaps, but we have some. And we need to strengthen that. The state needs to do a lot more in that area. They've really washed their hands of this, because the promise was if the hospitals were closed, there'd be support for those folks in the community,
Right.
and that didn't materialize to numbers it did. But now we see the increase in the jail population. So we're making great progress in diverting people out of incarceration who don't need to be there, or can be better treated elsewhere. We're still losing ground in the mental health area. And many of our homicides are related to mental health.
sure.
Well, I wanted to ask, because I know that, ever since the deinstitutionalization of people, that, mental health, people not getting treatment, et cetera, has been an issue. But of the people who are coming into the system, when you're talking about the numbers being processed, are the majority of people who come in facing mental health issues mentally ill to that degree? Or is there some other mix of people?
Here are the latest numbers. So for 2014, there were
About 45 seconds left.
there were about 10,000, roughly 11,000 bookings at the CPU.
Right.
And about 2,300 of those individuals required immediate medical attention, a majority for mental health reasons. And that is up 15% in the
Right.
last 2 years. So about 15% of the male population, about 30% of the female population in jail have significant mental health issues, and that difference
And
is
of course, there are
interesting as
always
well.
family implications then, right?
Oh,
You're
yeah.
not only just often dealing with an individual who you're seeing, but then you have to think of the ripple effect.
That's right. It's a huge ripple effect, so it's a big issue.
Define success for me in your job.
Success is bending the curve down on crime so that we have less crime and better outcomes in the criminal justice system. And in the case of mental health, we'll get better treatment. We need to provide better treatment for people who are mentally ill while improving public safety.
Phil, give our best to the state's attorney. Thank you. Great credit to the office. We appreciate you being here. We'll be right back after these messages. And we're back. Stuart, welcome back.
Thank you, Don.
Now, this edition of the Beacon is not only just full of great news, but you also have an insert, a resource guide. Maybe we
It's
could
not an insert. I'm sorry if I confused you. It just came out at the same time.
Okay, well, maybe if you
Right.
wouldn't mind holding it up.
Sure. This
All
is
right.
the 2015 edition of the Montgomery County Seniors Resource Guide.
Okay.
It's a project we've been doing for the county for the last dozen years or so.
Right.
It's an annual directory, A to Z, of all kinds of services for
Okay.
older adults and their families. More than 1,000 listings, and it's all paid for by advertising and support from the community, so it's totally free to the public and free to the county.
Just like the Beacon.
Yes, yes.
So let's go.
So you
great
pick up
resource
copies
guide.
at the public library, at the senior centers, anywhere you find the Beacon, pretty much, or call us if you need copies, and we'll be happy to supply them.
Perfect. Well, we can come back to the resource guide maybe a little bit later if we've
Sure.
got time. Looking through the Beacon this month, you've got an amazing story on cancer.
I thought it was very
Cancer
interesting.
research,
Yeah, that's why we made it our lead health story. People, cancer is fairly common nowadays, and there are a lot of cancers that have been studied very well, and people know what chemotherapy works, what treatments are best
Right.
regimens. But there are so many other cancers out there and so many individual cases where the doctors will say, well, we have a choice of 4 or 5 different chemo treatments. I sort of think this, I sort of think that. We want to try this. And people are like, oh my God, my life's at stake here. I don't want to
Right.
fool around, and being in one chemotherapy can take you down so much you won't
Sure.
be healthy enough to go through a second round. So what they're doing now, it's a private pay and it's in private labs, but a number of people are, they let you take samples of your tumor and they put them in different sets of mice and they try different chemos on these mice and see which ones the tumor responds to best. And then they come back to you and your doctor and say, we think this has the best chance of working for you. Isn't that clever?
It's amazing.
It's like instead of being your own guinea pig, you can buy your own guinea pig.
How
you know?
long does it take? I mean, to
There is a
put
time.
the tumor in there.
There's
to
a time
test
delay.
it
It
out,
takes,
yeah.
I think, around 6 to 8 weeks, something like that. So people
Okay.
usually start on something
Right.
in the meantime,
Yeah.
and waiting for the result. And it costs something like $2,500 per treatment that you try. So it's an average of $10,000 per patient to do this. So, and it's not covered by insurance. So
So, and how are the learnings shared? So if I'm a doctor and I figured something out, how do
Yeah,
I share
yeah.
that with all other doctors?
that's a good question. I'm not that familiar with the whole project. What I know is there was a recent presentation of a 70-patient study. And they tried these out and followed them through, and they discovered that when the mice did not respond to a treatment, it almost never worked in the people. But when the mice did respond and it was recommended, then 70% of the time it was helpful. So that's a pretty good record.
That's
Yeah.
really
How do patients find out that it's an option?
That's a good question. I mean, if you read the Beacon, it tells you sort of who to contact on it. But I don't know really if all doctors are on board with this or not. They might be against it. Some
Well,
of them. I don't know.
Is there any sense that if this continues to be, as reliable as it is, I mean, I would imagine an insurance company might then want its patients to do that
Yes.
because it would
Absolutely.
certainly
In
the long
save
run,
them
right.
from going through a
Right.
whole chemo
Well, it's my
treatment.
understanding that what they're really working on is much better, faster, quicker, cheaper ways of doing this by in a petri dish, check the tumor against different chemos and see what works. They're working on those, and that will be much more efficient and quicker and cheaper.
And I would
but
say that
it hasn't happened yet.
I would say that the mouse or the mice union would be happier with a petri dish as opposed to continue to lose.
Most likely.
Yeah.
Most likely.
You were going to say something?
Well, just they could title the articles of mice and men or something.
Yes, indeed.
But mice and people. But that is encouraging in terms of the correlation, at least,
yeah.
between the impact, the positive
Sure.
impact on the mice in terms of treatment.
And we've learned so much about the
results.
fact that individual variation matters. Like for a long time, we
Yes.
recognized what's true for men isn't necessarily true for women, right? I
Right,
mean, in
right.
terms of what we understand about
Right.
medications and how
Right.
they work. And so this is really allowing you to get to a whole different level.
Yes, and of course cancers are also mutations, so everybody might have their own particular needs.
So I have a family member going through this right now, and I know that that individual will be very excited when I share this.
All right,
share
good,
this.
good.
Yeah. What else?
Another story is on fortified foods. I mean, we see all the time, they've added folic acid to cereals for years. Those make sense. When you process grains or you make cereals or whatever, you lose some of the natural benefits. So you add back in what you've lost. But at the same time, when you start adding 100% of the daily values of every vitamin and mineral out there, then you're getting in an area that you're probably wasting money and time.
Is there any harm that's done?
There can be.
Because
There
most
can
of it's expelled, as I understand
Well,
it.
if it's a
when you're-
water-soluble vitamin or mineral, yes,
Right.
it could be expelled. Although even those, if you overdo them, like niacin, can cause rashes or stomach
Okay.
upset. But there are also problems in that there are fat-soluble vitamins. Vitamin A is particularly well known for that. And it can be toxic at high levels because it doesn't leave the body.
So is the concern that the labeling we have now is inadequate and we need to do something different?
It's not regulated. The
It's not
FDA
regulated.
does not
Right.
regulate this. So that's part of the
Supplements.
problem. Years and years ago,
10
30
seconds.
years ago, Congress decided not to touch it. It was lobbied and said, okay, we'll leave hands off. I think it was a huge mistake. I think it's never been addressed again. But in the meantime, that's part of our problem. Supplements can be sold.
Well, Congress may be touching it because I saw a report last week that they did a study of the nutrients that these GMO, whatever these other, and 90% of them did not contain
What they said.
What they said.
That's a different matter, of
Right,
course.
different matter, but
Right,
so
right.
regulation. It's great to have you here. I wish we had more time to talk about even more stories. But the resource
pick it
guide,
up
get the
then.
resource guide, and the Beacon. You got 2 publications this month for the price of 1, which is free.
Zero.
Thank you very much.
Thank you.
Shirley Brandman, it's great to have you here.
Thank
Great
you for
to
having
see
me.
you.
Thank you.
So, former president of the Board of Education.
Yes.
We're not going to, this is not we're not coming to you again more about the board and the superintendent, new one. We're talking about an exciting new program here in
Yes.
Montgomery County. Tell us about it.
So Montgomery Moving Forward is building on what's going on across the nation called collective impact efforts. And boiled to its essence, the idea is so many of the big challenges that we grapple with as a community at the county level are cross-sector problems. For example, we were just talking about mental health. State's attorney can't solve these problems alone. So if you've got cross-sector challenges, it only makes sense to try to bring together cross-sector leadership.
Yeah. Especially since we see these problems, we see elements of these problems through our own vision, through whatever if we are supposed to be addressing these issues, And sometimes it's tough to get out of this. We're all so
Right.
busy.
Well, and even, when I sat on the Board of Education, we would often talk about wanting to break down the silos, right? Because we know, for example, truancy is not just a problem at the school system level. There are issues going on with families.
Right.
There are poverty issues. There may be transportation issues. There may be job issues. There may be homelessness issues. So the idea
Because people
is...
don't want to fail.
Well, it's not that they're deeply committed
Right.
and they recognize these are challenging
Right.
and complex issues. And the reality is that even when we try at an individual level, you don't often have leaders from different sectors sitting together. I don't often have the opportunity to sit as a board member, Board of Education, with head of industry and philanthropy and nonprofits and other, higher education. So the idea of these collective impact models is you bring together leaders from across various sectors. You really try to get to the quote unquote CEO level. So you have people who have the authority to make a commitment on behalf of their entity, or at least to bring back a persuasive voice, and you try to look comprehensively at the issues to make the county, help the county move in better directions. We don't pretend to be experts on all issues, just trying to leverage the leadership that the county has to help move the county forward. So our first effort, frankly, was to try to think about where might a priority be, and our first issue area has been around workforce development.
Okay.
And we're really excited because it's a moment. In fact, the county executive at his inaugural address pointed out his sort of 6-point plan, and one of the things he talked about was workforce development, called out Montgomery Moving Forward, because we issued a call to action in October that really said, we as a county, we're deeply dedicated, but we have many random, wonderful acts of workforce development, and unless and until they are aligned,
Right.
unless we can come together collectively, we're not going to see the kind of success. So our overarching recommendation was to have a single, readily identifiable entity that's going to own this, that's going to work with higher education, that does a lot of our training.
So how would an issue area go about coming to your attention? For example, seniors.
Right, there you
Comes
go.
to mind.
Absolutely, and David
Always
Jones is
comes
one of
to your
our
mind,
leaders.
Stuart.
Yes.
Yeah.
Well, but all these issues have implications for seniors, right? Because it really matters to seniors who live in the community that we can train the right workers, have skilled labor. Allied health is a growing industry in Montgomery County.
Sure.
Are we training people to be able to fill the vacancies? The state of Maryland is going to have a shortage of nurses. What is the impact in Montgomery County, and are we training
No,
people?
I understand that's
Yeah.
part of what you're doing there, but I'm saying if we're looking at the demographic changes in the county and the growth of the
Absolutely.
older adults and
As an
boomers
issue.
retiring, and yes, as an issue, what we
Absolutely.
can do, how we can make sense of all this and make
Totally
make
the
it
kind of issue, because clearly there are implications. Again, it
Cross-cutting.
affects the seniors, right, but their families want to participate, and it touches on housing, and it touches on
Right.
transportation.
So how would
The
we get
model
you all
we
to take
used-
that as one of your
I will bring it back
priorities?
to the
All
table,
right.
no doubt. So that was, we really spent, we invested 6 or 7 months trying to figure out where we could have an impact, where we really saw that there was an opportunity, and clearly there is momentum growing around this. You do have the county executive invested, you have the county council. The Fed committee has been looking at what is going on in terms of workforce
So
issues.
workforce is what you're looking at. What are some of the other things that, after you solve workforce?
After
that you
we
might-
solve
No,
workforce.
but I mean, that really came to the attention that are some big problems that need to be
Well,
grappled with.
models across the country, they've taken on environmental challenges, recognizing again that there are issues about education about pollution, there are issues about enforcement and cleanup, there are issues about incentives that get created legally. So, that's been an issue that people have taken on. Obviously, in the education arena, we could pick issues. We could look at truancy. We could look at, the achievement gap. We could look at after school time. I mean, those are all, in fact, the Collaboration Council, which is a terrific model, right? They're Excel Beyond the Bell. In part, it worked because it was the coming together across sectors.
It sounds like the philosophy or the approach behind it is if you're going to have that collective impact, you're going to need systems change.
Absolutely.
You're going to need to get people at the table from all the different sectors or interests, stakeholders, to grapple with this together and have authority to make decisions
Right.
and commit their organization.
And it's more than
30
just
seconds left.
collaboration. It's not just partnership. It's really recognizing that interrelatedness. So if you come together around a shared agenda and you make a commitment to impact all the systems toward a goal, you are more likely to get there more quickly.
But you're just taking one priority at a time.
Starting right now, yes.
Okay.
And working
You
hard
couldn't
to be able
do
to...
you couldn't have several things running simultaneously on different
So
topics?
to do it well, we felt that it was important to stay focused and these, to really to develop the expertise. There's shared learnings. We've had symposiums. The idea is to build enough of a foundation to move forward.
If you do move to seniors, you've got a great expert next to
Absolutely.
you. Bring them in.
Thank
Shirley,
you.
thank you so much.
Pleasure.
Well, thank all of you for joining me today. It's
Thank
been a
you.
great show, and I want to thank all of you in the viewing audience for joining us for this week's edition of Montgomery Week in Review. I'm Don Mooers, inviting you to join us next week at this very same time.